Hello, my name is Dan Quinn. I'm the Vice President of Healthcare Integration at Innovative Care Partners, what we call ICP. Our company is a limited liability corporation, and the managing partner company is called the Center for Human Development, which is a mental health center. I'm the operational lead for ICP. What we do is we provide care coordination services for approximately 4,000 Massachusetts Medicaid enrollees. These are enrollees with complex care needs, and the goals of our program are to improve their health outcomes and reduce their total cost of care. In 2018, Massachusetts Medicaid, what is called Mass Health, began a healthcare reform initiative. Part of that was to create accountable care organizations for the Medicaid population, what is called Mass Health. And an ACO in Massachusetts is really a combination of a managed care entity and a large healthcare provider, usually a hospital care system, in some cases a statewide network of federally qualified health centers or other large-scale healthcare provider. As well, at that time, Mass Health implemented the Community Partner Program. That's what ICP is. What we do is we focus on, as a statewide entity of companies, a complex care population of about 40,000 enrollees out of the approximate 1 million Medicaid enrollees overall in the initiative. So our enrollees are selected because of their high utilization of medical services, behavioral health services, and a large total cost of care. And once again, the goal of this entire initiative by Mass Health is for this entire population to improve their health outcomes and reduce their total cost of care. Well, when the program started, what Mass Health did, which is different than what has been done for many years in our industry, Innovative Care Partners provides care coordination services, which means we assist enrollees with health-related social needs, with navigating the medical care system, with navigating the behavioral health care system. These kinds of services have really been in place since the 1970s. There's really nothing new about them. What Mass Health did, which was quite different, is they provided all of us 2 years of medical claims information on every enrollee every month. We were charged by Mass Health with using this information to better inform our services, make them data-driven. And this is what's quite different. Because of this level of information, we needed a partner. And this is where Hexplora is vital to our success. As well, what Mass Health implemented as part of the healthcare reform is a different payment mechanism. It's a pay-for-performance system. So we have performance-based, value-based care, and we have performance-based metrics that help fund our programs. So we use Hexplora to take all of our information from these medical claims, from our electronic medical record, from our admission, discharge, and transfer event notification system, to develop rich analytics which can drive our care coordination services, make them more refined, more targeted, and more effective. Well, we began working with Hexplora in 2018, and at that time, we really focused on our engagement analytics, which is how we engage members in joining our program and getting our assessments and care plans done and documenting our clinical services. From there, we expanded to analyze claims analytics, provide a hierarchical conditions category dashboard so we could understand the illnesses of our population, right? And that allows us to design strategies to change our program design a bit to better meet the needs of our members. We also wrote analytics, developed them for all of our paper performance measures so we could see our own performance on an ongoing monthly basis and use that as part of our quality improvement process. Ultimately, we also added artificial intelligence-based analytics, and this provides predictive capabilities to understand what may happen to our enrollees, to provide more proactive services. More recently, we've also developed a natural language processing engine to read our electronic medical record to further guide our efforts with antidepressant medication management. So these are some of the ways that we have partnered with Hexplora to develop an analytic dashboard that helps guide our services. I think Hexplora is best defined in a few ways. Words come to mind like partnership, customer service. When in working with Hexplora, you are not simply asking a technician to develop something for you. You're working with a partner to understand your business need, to understand your clinical need, and develop analytics to meet your needs. And in terms of customer service, I think the best way I can describe it is a boutique level of customer service. It's the best customer service that I've encountered in any business entity, in any endeavor. So that combination makes Hexplora both very effective and in many ways a pleasure to work with. Certainly we work with many of them. Let me give you a few examples. We have an artificial intelligence powered readmission predictor. What that does is for every person discharged from a hospital, it assigns a probability as to whether they will be readmitted to the hospital within 30 days. Well, that's very important information for us. So that allows us to give that person extra services and extra attention for the next month to see if we can prevent them from going back into the hospital. Some of the services we provide are having a registered nurse contact them on the phone and review their discharge plan they got from the hospital. We have a care coordinator talking to them about any barriers they're encountering to adhere to their discharge plan. When that process works effectively, we can reduce readmissions, which actually has an additional effect of reducing overall avoidable utilization and reducing total cost of care, which not only are some of our key goals, but they're also key metrics. Another example is our natural language processing engine. In essence, it reads our electronic medical record. We focused that on our particular need. Our need was assistance with having our clients adhere to their antidepressant medication management regimen. While we are not providers, we can identify if a person needs to refill their prescription, and we can ask them if there are any barriers, if they have any concerns, and we can once again engage with their pharmacy or their prescribing provider. So this kind of information, once again, is helpful in improving a health outcome, and in this case, it's a very specific performance metric for us. I would say one last thing is a hierarchical conditions category method of ascribing disease states. This helps us understand our population and design our program. For instance, in our population, we have a high incidence of diabetes and morbid obesity. That helps us design certain care coordination initiatives, helps educate our accountable care organization partners that we work with around the needs of this specific population and what we might be able to do to design services to better meet those particular needs. At this point, we have a comprehensive set of analytics. I think the next step may be, and is there a better way that we can make these simpler to use for some of our direct care staff? And I think we've come upon a method of doing that. I think we can use large language models in our analytic dashboards so that we can literally ask a question of the dashboards, right? And we will then get an answer back, rather than having to ask for another report to be written or ask for another dashboard to be developed. If we can make it so that it's simpler to use for direct care staff, they could ask a question such as, for Dan Quinn, what are the things I should be focusing on with Dan in the next 3 months? And it may be able to inform the care coordinator that Dan needs an annual well care visit, and Dan could use a diabetes screening test, or possibly other things that are going to be helpful for Dan's health outcome. So in this way, we can bring the rich information that we've developed to a larger audience in a simpler means.